അതുപോലെ ഫുട്ബോൾ എടുത്ത് വെച്ചേക്കുന്നോണം കണ്ടല്ലേ. എന്റെ പാട് അത്ര ഇല്ലല്ലോ. ഞങ്ങളെ രണ്ടര ഒരുപോലല്ലേ നീ? അത്ര ഇല്ലല്ലേ? അയ്യോ അങ്ങോട്ട് നോക്കിയാൽ മോഹം കൂടെ മേടെ കണ്ടില്ല. എന്നെ കുറച്ച് സ്പീഡിലൂടെ വീട്ടില്ല. വേദന ഉണ്ടെങ്കിൽ സാരമില്ല. അയ്യോ
പോലുണ്ടോ?
അങ്ങനെ വേണ്ടി
നാട്ടിൽ കൊണ്ടിരുന്ന
അതെ കുഴപ്പമില്ല. തൊഴി വല്ലതും ഉണ്ടോ നോക്കടാ. ചിലപ്പോ നല്ല തൊഴി കിട്ടും. നല്ല തൊഴി കിട്ടും. അല്ലെങ്കിൽ അത് നാട്ടിലാരും കണ്ടിട്ടുണ്ട്. ഇവിടെ ഗ്ലാമർ പോയില്ലേ? ആരാ കണ്ടാണോ സംശയം വന്നോ? ഇത് ട്വിൻസ് ആണ് കേട്ടോ. ഇതാണ് ട്രിപ്ലറ്റ്സ്, ഇതാണ് ട്വിൻസ്. ഓക്കെ.
ആറ് മാസമല്ല 10 മാസമായി അങ്ങനെ തുടങ്ങി. പതുക്കെ ഇവിടെ വന്നിരിക്കും. ഫോട്ടോ വിമാനമില്ലെങ്കിൽ
ഹിന്ദി പിടിച്ചാലും കഷ്ടമായിട്ട് വരുമെന്ന് എനിക്ക് തിരിക്കണ്ട, കുഴപ്പമില്ല. അതാണ് അത് നാശമാക്കണ്ട. റെക്കോർഡിങ് ചെറുക്കൻ ഭയങ്കര തൊഴിയാണല്ലോ. അടി കിടക്കുന്ന പെണ്ണിനെയാ തൊഴിക്കുന്നേ. മൂവ് ചെയ്യുന്നുണ്ടോ വേറെ? മൂവ് ചെയ്യുന്നുണ്ടോ? മൂവ് ചെയ്യുന്ന അറിയാം.
ഇവിടെ ഒരു തലയുണ്ട്, ഒരു ബേബിയുടെ ഹെഡ് ഉണ്ട് ഇവിടെ.
വിളിക്കട്ടെ.
Bye.
അതാ ശുശ്രൂഷ പിടിച്ചു കയറ്റിട്ടുള്ള നിങ്ങൾ
കൈ തുറന്ന് ടച്ചൊന്നും പിടിക്കാൻ കൈ കൊണ്ട് തുറന്ന
ഇവിടെ അങ്ങോട്ട് പൊക്കി വെക്കാം നമുക്ക് ഇവിടെ അടിവെക്കാം
ഇവിടെ കൈ
അതെ ഓക്കെ നീ ഉറങ്ങി
പിന്നെ നമ്മൾ
ഇല്ല കുഴപ്പമില്ല കുഴപ്പമില്ല
ഇത് മാത്രം നമുക്ക് പറയാം
We'll get this bag in, and once this bag is in, and I'm going to take this bag into now and replace it this way. Okay? So we'll do that here in a minute. Yes, ma'am. Yeah, it'll be just a minute before I do that, but I'm looking at her. Just like you would for anybody else. Yes, I did. Okay, good. Misty, where's the...
Okay, the hard drink. Okay, done.
Were they all girls?
Let's the cat. Good baby, good baby.
49, 50, and 51.
All right.
Okay.
Sorry. Being all right? first in the transport isolate. Let's put in a rate of about 30.
We'll put more tape on it when we get there.
And I put in a rate of 40. And the pressures of 15 or so.
Okay.
High time 0.5.
Thing does not fit well.
I think she's gonna wake up.
We were equal,
Okay, I got a picture of each one of them. If we take any more, then we'll get confused.
Okay, that's
One of
fine.
each.
Thank you.
Okay.
This thing is between the eye and the mouth. Yeah. Can you take care of? You want to put one more
That stuff starts to wear off and kind of drip down, so you start kind of skating with it. Yeah.
Yeah. Ready?
Do you want to take this one back along with that one?
You can get some oxygen, yeah. Why don't you get some oxygen? You pre-flow fire. You have,
Yeah, you can give a little better.
okay. You put it next to the mouth and nose and okay. You ready for this, baby? Let's take it to the street. Let's go.
Here we go, P.
Thank you.
Let's put it quick. Are we taking this one too? I'm gonna grab the bag. What?
Move him down, yeah. There you go, there you go.
Oh, look at her.
Yeah? Yeah. That's pretty good. A baby is only one having bed, but B and C are not in bed yet. Working in the ICU from there.
Okay?
Can I see your face for a second?
She says no. There you go. Okay?
Okay, thank you.
Okay. Thank you, Marilyn.
Sorry, Dan.
The first one and another one, there's one in our box.
Right, it's the same test.
And when did we learn about COVID?
Two.
Yeah.
That's about what she was running. Temperature's 97.3. On your finger, okay? I wonder why this one's not there. I guess we don't need it, we might as well take this out of here. Make some more. Jeannie, can you take some big deep breaths? Do you this? Another one? Few more.
Dr. Charles Ingalls, 18600. Dr. Charles Ingalls, 18600.
Everyone gave me such the one, yeah, I mean, she came out screaming. She was just doing fine. She was just, her little while, and they make her feel like she's doing it. So you just never know. Yeah, they're fine, but so they have lots of them. Right. I'll go in there in just a minute to give them the paperwork and I'll get a report. I just realized we all do
So how is some other doing?
Show everyone the thing.
Blood carbon dioxide is a little high, so we're going to keep an eye and see. But I don't think that baby will need any help as far as breathing machine is concerned. If this carbon dioxide stays high and the blood starts to become acid, then we may have to help him with the breathing machine temporarily. But I don't think the baby has any premature lung disease. Okay. We're having a hard time to start the IV, so we're probably going to put a catheter to the belly button till he settles down. Okay. And we can give IV fluids that way without much problems. Okay. But other than that, everything is okay on the baby. Okay.
He's on 25% oxygen, right?
Okay.
His saturation is good.
3.2,
Uh,
3 pound and 2 ounce.
between 1 and 2 ounces, 1380 grams, 3 pounds is 1340 or 50, so it's somewhere between 1 and 2 ounces. And they are all going to lose some weight to start with, okay, before they start gaining weight. We usually lose about 10-15% of their body weight, so you can easily expect them to lose about 5-6 ounces, all of them. The next one, the one that's born in the middle, the girl, she's the smallest. She's 2 pounds and 8 ounces, okay. And that baby in the beginning did okay. We were giving some oxygen and then started to have trouble breathing, was pulling hard on my chest and stuff. So we put the tube in the windpipe, okay, and we are helping to breathe for the baby a little bit. The baby does breathe half and we are doing half on the breathing machine. We put a catheter to the belly button in the vein. We're going to get the X-ray done and make sure everything is in place, okay. That baby probably will need help from breathing machine maybe 2-3 days, at the most a week. After that, I think we should extubate them. All these babies sometimes may not have any lung problem as such, but they're kind of small to breathe on their own. So time will tell how strong they are as we go by, if they can breathe on their own, or if they can't breathe on their own, then we may have to use them on breathing machine just to give some breath so we can get them breathing, okay. So it's kind of hard to say exactly what, but we hope they will come off breathing machine in a week, okay. And I don't think they have really any significant amount of premature lung disease. What we mean by premature lung disease is that the lungs have to mature to produce a lining fluid, okay. And that happens somewhere about 30 to 34 weeks. And Dr. Stanley has given 3 courses of medication to help accelerate that mechanism. And most of the
5
time,
doses, I think. 6 doses.
no, I was talking about two times each time is
okay.
one course. So he gave, if you remember, he probably gave 12 hours apart, 1, 2, 3, every week or 2 weeks, 1.5 weeks duration. So I really doubt if they have anything as far as the deficiency is concerned. But they may be just a little small to breathe on their own, and they stay on breathing machine until they get bigger and strong. Okay. The third one, he weighs very close to the boy, is about an ounce less. Okay, 3 pounds. Okay, that one probably is on 3 pounds line. Okay, and that baby also same thing, wasn't breathing very well, so actually they put the tube in and the baby is on breathing machine.
That baby be intubated in the
delivery.
and then what happened? Just contractions or
He wasn't breathing.
quit the breathing completely or?
Yeah, that's a common problem because the brain does not mature to send the impulse to the muscles of breathing to say, come on, breathe. And, so when you don't get the impulse, so you just kind of don't breathe, and then the heart rate will drop.
Both the girls on 100% oxygen or?
No, they're all like 25.
Oh, that's it.
So I think the girl that Freddie had was like 25, 30, and the one I had was 30, 35. but some of this oxygen may change depending on how
Saturation.
agitated they are. Okay, if they are unhappy and keep kicking around like anybody else, when you're angry, turn blue, same thing happens to the babies too. Okay?
The three of them are active, right?
Yeah, they're active, they're kicking and moving around just like any normal baby this time. Okay. We're going to get the x-rays done, settle everything down. Okay. We're going to have a surgery at 10:30. See if we not on your baby. It's different baby. So by the time we get x-rays done and everything tucked in and that surgery doesn't start, we will let you in. Okay. Otherwise, we may have to wait till that is done, probably about 11:30. We'll probably expect it to be done, and we can let people in. Usually 2 people at a time. Okay. And that's mainly because we want to cut down on the infection. You know, the more people come in, we have more risk of infection. Okay. So we'll be like 2 people at a time and see the babies. Okay. Parents, usually parents and grandparents are doing it. Okay. All right. You have any other questions? We will wait till the breathing settles down, probably 2 days, 3 days, maybe a week at the most. And then once the lungs are stable and
Have any
everything
idea how
is
long
alright,
they're going to stay in an ICU?
I would say close to due
That's
date,
it.
but I think they will go home probably about a couple of weeks earlier than due date. You're probably looking about, yeah, you're probably looking about 5 weeks.
Middle of February, maybe.
Yeah, you will know as as time goes on. You're probably looking, your due date is what, March?
February
February 20th,
25th.
25th. So it probably will be in part of January. But you'll know at least a couple of weeks ahead of time. Because we get like 16, 1700 grams depending on how the babies are eating and stuff like that. The babies need to eat, maintain temperature. And they do it somewhere up to 4 pounds, anywhere from 4, 5, 4.5.
When we going to start to feed the moms milk,
About 4 or 5 days. Once we take care of the lungs, then we start feeding them, and the feeding will be done by 2 feedings. Okay. But if you're planning to nurse, you can go ahead and start using the.
How about the circumcision?
Okay. What and we have results on your plan. That's also important. We've done your plan. Okay. As far as babies are concerned, they should make it like any some babies, but they will have some problems because they're born early and they need to eat it. Okay.
so far they're doing good, right?
Yeah, so far they're doing good. One other thing that I don't know if we will or we don't, but sometimes, because the babies are small, that as babies grow bigger and also some of the blood tests we do, they could get anemic and then any blood transfusion. Okay. They need blood transfusion. There are 2 options per year. Either we can go ahead and get it from the blood bank and use the blood. Okay. If you want to donate what we call a direct donation program, whoever wants to donate, they need to go ahead and get some.
They're going to use that blood for the babies, right?
They're going to use that
We
blood
might,
for the baby.
parents' blood group is same, right?
Yeah, parents.
If they need, I can give my
But
blood.
this needs to be done ahead of time.
Okay, that's
Okay.
fine. Yeah.
So they'll give you all the papers when you go there, and if you or any one of your relatives wants to do it, then you need to go ahead and go to the blood bank and get checked out. Okay. They check for usual.
Yeah, I already went there and got my last year my blood.
Okay, so but they will test for another what is called a CMV virus. Okay, and we want a CMV negative blood. Okay, for usual transfusions they will take CMV positive blood. So once you donate blood does not mean they will take for the baby. For babies we want it to be CMV negative blood for babies or people who are under chemotherapy or anything like that.
So if I give the blood, the same blood we're going to use if we need.
Yeah, that's called direct donor program. They may charge you a little bit of money to do the paperwork and keep the blood separate.
That's fine.
And, but that's the blood they will give. Okay,
But only we need, right?
Yeah, only
We don't know that now.
We don't know that now, but given the size of the baby, it's likely that they may need, and it's better to do ahead of time rather than when the baby gets into trouble and then we want to give blood. We don't have time, then we use whatever we have in the blood. Okay.
So you're going to give the papers for us?
Yeah, when you get there, they'll get your whole packet of everything about premature baby, what you expect, and what are all the things that are done, and options about blood transfusion, and what are the risks of blood transfusion, all that. Get a big
She was, 214,
288, right?
no, 214.8.
Just a moment.
I believe 214.
I think you're right. This is,
So बाहर क्या
oh, down there, no breathing.